Viral hepatitis have become a prominent killer disease in Nigeria, even competing favorably with HIV and AIDS in terms of casualties. Some of those affected are burdened by lack of funds because of the huge cost of treatment of the disease. Welcome to the program that gives you first-hand info on health matters. I am Rekia Mahmoud Awal, and today therefore our focus will be on viral hepatitis. We have features and an expert who will be throwing more light on viral hepatitis. But before we meet our doctor, let us take these features.
The sudden threats to human lives by diseases seem unending. From HIV/AIDS to tuberculosis, the list looks endless. Viral hepatitis is a disease that has taken the center stage and equally proved to be a burden to healthcare delivery in Nigeria. The virus kills faster than HIV/AIDS. According to reports, about 100 million people are infected across Africa, with hepatitis B alone accounting for an estimated 650,000 deaths due to related liver diseases, such as cancer. In Nigeria, about 13.6% of the population are already affected by the virus.
For us in this part of the world, given our experience, we have most commonly the hepatitis B and C, and the level of awareness amongst Nigerians on these is very, very poor. Averagely, if you bring in some of the rural communities, if you test 10 fellows, you are likely to get up to between 4 to 6 persons that come positive.
Despite these alarming figures, awareness still remains a challenge even 51 years after the virus was discovered.
It's actually a case that somebody should worry about because it's the 7th killer disease in the world now, and people are not aware of the infection. So that's why we really need to get people educated on the issue of hepatitis, because some people don't get to be tested, some don't get to know the information of how they are infected. So we need to sensitize people on the issues concerning hepatitis.
One other factor that has continued to stall efforts in tackling the malady is the high cost of services, such as providing treatment to people who have been tested positive for the virus.
The cost of getting facilities on ground is one of the primary reasons why it is costly. To get a viral load machine set up in any facility is a huge cost. It's a huge cost. So you don't even find enough private facilities having it. And secondly, because we do not seem to have sufficient physicians who has the professional capacity to provide treatment in this direction. Given the recently launched strategic plan by the Federal Ministry of Health, plans are on way to increase access to treatment in the country.
If government can on their own subsidize the rate at which treatments are being given to patients, I think it will go a long way, because somebody like those in the rural communities cannot afford to pay 40,000, 50,000 for testing and then for the drugs as well. So if the government can merge it with HIV, malaria and the rest, then people can be able to access treatments and care.
With regards to these mentioned challenges, most of the people tested positive are Nigerians within the lower social status of life. Some of these indigent persons lack basic necessities of life, such as shelter, food or clothing, and due to these conditions they are unable to access health services, thus spreading the disease.
Prevention among positive is an area of concern. And what we do, once you test initially through our through our rapid diagnostic testing, and you go for further diagnostic tests at the referred center. Once we follow up, we continue with adherence counseling, both for the treatment the fellow is taking, while ensuring that we give you adequate information as to how you should protect yourself and further prevent spreading this.
Viral hepatitis is not a disease that should be treated with kid gloves because it has more complications than HIV/AIDS, which ordinarily should make one wary. In view of these, it is expected that the government will come to the aid of those affected by scaling up the services at all stages of healthcare facilities and subsidize treatment in collaboration with others until the disease is eradicated.
We intend to reach out to NACA, given the fact that the WHO has recently approved a new strategic prevention plan for hepatitis by integrating hepatitis with HIV, malaria and TB, such that it becomes easier to drive the process of prevention and treatment using existing structures. So our aim is that this year we will be able to engage with duty bearers at agencies of government like NACA and the Ministry of Health, FCT specific, FCT Health and Human Services Secretariat, to see how they can open up the existing structures for prevention and treatment and impact mitigation for HIV to include hepatitis in line with the newly approved WHO strategic plan, which targets us eliminating hepatitis by 2030.
It is no longer news that viral hepatitis is a deadly disease. However, effective and efficient partnership with stakeholders at all levels will help in eradicating the scourge in our society. July 28th every year is celebrated as World Hepatitis Day. This year's theme, No Hepatitis, Act Now, is a wake-up call to policymakers, health workers and the public to not just know about the disease but to get tested and get treated in order to reduce the spread of the disease as well as death. However, stakeholders are worried about this scourge.
Part of the findings from the prevalence population-based study was that the national average for viral hepatitis is placed at 11%. National average. What that means is that when you go through state-specific prevalences, you discover that there are higher values than what we have at the national level. In some cases, the value could also be lower, but nationally the average is 11% for viral hepatitis B, and then for viral hepatitis C, the estimated national prevalence is 2.2%. So that is what the situation is. For a layman, if you want to translate what that prevalence means, is that you apply 11% of our estimated 2016 population. That is 11% of 192 million people. Of course, you know what the value will be. Close to over 20 million.
One approach that is being used to end the disease is the use of vaccine. This approach recorded tremendous success in the elimination of polio. Replicating this approach will be a welcome development.
From the national level to the state level, we want to see what institutions, what organizations exist with interest for the control of viral hepatitis from the national to the state. So that, for example, if you go to Nasarawa State, you do a mapping of partners that are present there and that have indicated interest, non-governmental organizations, faith-based organizations, traditional institutions that have interest in the control of viral hepatitis, put it together as a compendium for the country. Work is currently ongoing on that. And once that is done, then stepping down implementation will be an easy work to do. 60% who don't go to a normal facility to deliver. Even if, presumably, the vaccines are available at the formal public health facility, public or private, what of the mothers that are born at home? What of the mothers that go to traditional birth attendants to deliver? What of the mothers that are born at faith-based organizations, traditional institutions, and many others? It's actually a very big problem. But I think it's doable because we have an idea of where all these events happen within the community. The only thing is the political will and then getting the funds that is needed to reach out. If this is done, and then majority of people could access the vaccine, then the law of demand and supply comes in place. The more they demand, the less the price comes. More people go, and then the volume for request will rather be used as a form of negotiation to reduce the price.
In this regard, government will have to wade into the services rendered, subsidizing costs and providing some basic services to the people.
Awareness will create knowledge. Knowledge will create demand. Demand will create supply. And once there is demand and there is supply, the needs are met. We treat the interest. The interest is let people get to know what their status are. For example, if I should ask you, have you tested for viral hepatitis B or C? If the answer is no, go do the test. And I'm not stopping on you alone. Go home, ask your wife. Ask your wife if the children are immunized against viral hepatitis using pentavalent or monovalent at birth. Tell your friends. Tell your colleagues. Go to your church, talk about it. In your mosques, don't be silent. Let people get to know that the sequelae, the consequence, the complication of viral hepatitis is much more expensive to manage than to prevent it. So know your status.
Implementation of every point in the policy document is vital in achieving the said objective of eliminating viral hepatitis in Nigeria. In view of that, government approach is paramount.
Most Nigerians don't seem to be aware of this virus and its far-reaching consequences. And today in the studio, we have a consultant, gastroenterologist and hepatologist with Asokoro General Hospital, Dr. Uwabuchi Chidi. Doctor, you're welcome to the program.
Thank you very much. Good morning, everybody.
Now, doctor, why all of a sudden hepatitis when people are still struggling with HIV and AIDS?
Well, hepatitis has always been there. It's not a new illness. It's just that the awareness was very poor. Of recent, awareness has improved. That's why a lot of effort is now being made to control it, and it's been found to be a very deadly infection.
All right. So now, can you just briefly tell us what is hepatitis?
Okay. Hepatitis simply means inflammation of the liver, and it could be caused by several factors, which could be infective, chemical, drugs, toxins, but we are more interested in the infective causes of hepatitis.
Okay. So, are there any classification of hepatitis? Because you said Nigerians are more, prone to hepatitis. Is it B also?
Yes, there are different viruses that cause hepatitis. There are 5 major hepatitis viruses. We have the hepatitis A virus, hepatitis B virus, hepatitis C virus, D virus, and hepatitis E virus. The ones that we are more concerned about are the ones that could cause chronic infection and could cause serious complications in the liver, and these are the hepatitis B and C viruses, and then to a lesser extent hepatitis D virus. We have hepatitis B virus is much more prevalent in our environment than hepatitis C virus.
Okay. So why is it so?
Well, we find ourselves in an endemic zone, and they are actually the same way people get HIV are the same way that they get hepatitis.
Okay. So what are the ways that we get contact this ailment?
Okay. Hepatitis can be transmitted either from hepatitis B and C, can be transmitted via transfusion or contact with infected blood and blood products. Okay. It could be transmitted sexually. It could be transmitted by sharing sharp objects, which will include razors, pedicure, manicure instruments, tattoo instruments, clippers, needles that women use in salon, sharing of syringes and needles, and then even sharing of toothbrushes, because you find that sometimes when you're brushing your teeth, you bleed. And if another person uses that toothbrush, if the first person is infected, he will transmit it to the next person. It could also be transmitted when people get scarification marks using contaminated instruments, and then from mother to child during breastfeeding and at birth. So these are the ways you can get hepatitis B and C, and it's actually the same way you can get